Good afternoon. I am Dr. Joss Reimer, the medical lead of the Vaccine Implementation Task Force. Today we are expanding eligibility to book your second dose to include people who received their first dose on or before May the 14th. Tomorrow, it will expand again at 11:45 a.m. to include people who received their first dose on or before May the 18th. So if you're newly eligible, I'd encourage you to book your second dose appointment online or by phone. As you know, the second dose provides the fullest protection against COVID-19 for both you as well as the people around you. We are broadly increasing the options and opportunities available to people who face barriers to immunization in numerous Manitoba communities by expanding mobile clinics, pop-ups, and community clinics, as well as walk-in vaccinations at supersites. This expanded push for greater access will be carried out this month and throughout the summer. We want to make it as easy as possible to reach all Manitobans who are interested in the vaccine, but who may face barriers to booking an appointment at a supersite, or may have questions or concerns about being immunized either for themselves or their kids, or will require support and information from people that they know and trust in order to get the vaccine. Johanu will go into more details on some of the examples of these plans that we have in the near future. I wanted to highlight some of the work that Doctors Manitoba is doing to reach out to Manitobans as well. Physicians will be responding to vaccine questions from members of the public at 4 different town halls starting on June the 21st. These sessions will allow Manitobans to ask questions and raise concerns about COVID-19 vaccines and get answers directly from doctors who work in Manitoba in their communities. Manitobans can also send questions in advance if you go to manitobavaccine.ca. We have received a few questions about temporary foreign workers, so I wanted to explain a bit more about our approach to reach this population. First, to be clear, while we do want someone to come with some form of ID, a health card is not required. The vaccine is available at no cost to anyone who is living in Manitoba for any reason. You also will not be turned away if you don't have ID. The regional health authorities have already been connecting with many employers, including those who employ temporary foreign workers, to facilitate vaccination of employees. In some cases, this included creating group bookings at supersites. In other cases, it involved bringing the vaccine directly to the workplace. We hope to achieve higher levels of vaccination uptake in the coming weeks and months as we build bridges with more employers and with these communities. Additionally, anyone living in Manitoba is welcome to book their appointments directly. So they can call the call center, who can book for anyone regardless of whether or not they have a Manitoba health card, and can utilize interpreter services on the phone if needed. Finally, we also know that many migrant workers are supported in Manitoba by many of our community organizations. Those organizations and employers are able to apply for the Protect MB Community Outreach and Incentive Grants if they have specific ideas or plans on how to reach this population. Before I move to the next topic, I do want to make something very clear directly to those individuals who live in Manitoba but may not be a citizen, such as temporary foreign workers. It is your choice to get vaccinated. We have heard that some employers are not supportive of their workers getting vaccinated. So I want this to be very clear that you do not need the permission or the support of your boss to get the vaccine. You can call the call center and book an appointment, whether or not you have health insurance here, and the call center can use over-the-phone interpreters if needed during the booking process, as well as when you're at the supersite. As well as Johanu will describe, there are also walk-in options that will be available at most of our sites that you would be welcome to attend without an appointment. Antes de pasar al siguiente tema, quiero dejar algo muy claro para cualquiera que vive en Manitoba y que no sea ciudadano como los trabajadores migrantes. Es tu decisión vacunarte. Hemos escuchado que algunos empleadores no apoyan que sus trabajadores se vacunen. Quiero que esto sea bien claro. No necesitas el permiso ni el apoyo de tu jefe para ponerte la vacuna. Tu jefe no necesita saberlo. Puedes llamar al centro de llamadas y reservar tu cita incluso si no tienes seguro médico en Manitoba. Es gratis para todos. En el centro de llamadas tienes acceso a intérpretes por teléfono para ayudarte con la traducción durante el proceso de hacer cita. Además, en el futuro cercano, empezando con Lila ayer, la mayoría de nuestras clínicas tendrán opciones sin cita previa y podrás ir a cualquiera de esas clínicas cuando estén abiertas para personas sin cita previa. En todos nuestros supersitios puedes acceder a traductores telefónicos durante tu visita. Solo necesitas pedirle el favor a personal en la clínica y ellos te pueden conectar con un traductor. I also today want to give an update on AstraZeneca. I know there are many people who received AstraZeneca for their first dose and either cannot or will not receive mRNA for their second dose. I want to thank everyone who received AstraZeneca for your first dose, for your patience on this. I know this has been confusing and frustrating, but our team is so appreciative that you chose to be vaccinated when and how you did. Manitoba has received 7,500 doses of AstraZeneca from the federal government. The AstraZeneca will be available at several hub clinics and pharmacies in every regional health authority. We are working directly with these locations to finalize exactly which facilities will be identified as hubs, and we'll share this information with you hopefully later this week, but no later than next week. These hubs will be available to anyone who received a first dose of AstraZeneca, regardless of where they received that dose. In regards to medical reasons for not being immunized, I wanted to share a few things as well. We are all safer when more of us are immunized against COVID-19, which is why it's so important for us to now consider vaccine access along with speed in our immunization campaign. Fortunately, we know that almost everyone can be immunized safely, with the exception of some very specific medical reasons that affect a small proportion of people. And so our every effort is on making sure that Manitobans who can get vaccinated will get vaccinated, so that we can protect those who can't and are therefore at higher risk. Those who may not be able to get vaccinated include people who are acutely ill, such as those who are admitted to hospital for a heart attack or some other condition like that. While you're acutely ill, you should not get the vaccine. But thankfully, once people's health status stabilizes, they will be able to receive the vaccine after being acutely ill. Because there are a small number of people who are allergic to some parts of the mRNA vaccine, this is one reason why we need to have some AstraZeneca in stock. We also encourage primary care providers to refer individuals who are believed to have severe allergies to the vaccines to the Health Science Center Allergy Clinic. People with allergies to other vaccines, or even allergies to the ingredients in these vaccines, can usually still receive one of the vaccines after an assessment by an allergist. The allergy clinic can assess the risk and can, for example, provide things like a gradual supervised dose for some individuals. To wrap up, I'd like to speak again about how the mRNA vaccines that are available to us now can be used. These vaccines are considered equivalent overall. Both of the mRNA vaccines are safe and effective. If you're an adult, we want you to get the first vaccine available to you when you're eligible. And when it comes to your second dose, there's no reason to delay. You should still try to get the same product where possible, but you can have a Pfizer or a Moderna vaccine regardless of what you had first, if it means that you don't have to delay your second dose. You do not have to wait to get the same vaccine as your first shot. They give the same boost to your immune system to provide the best protection possible. This shift will help us fully protect more Manitobans sooner, and so that's great news for all of us. So with that, I'll turn things over to Johanu. Thank you.
Thank you very much, Dr. Reimer. Good afternoon, everyone. I'm Johanu Botha, the Operations Planning and Logistics Lead of the Vaccine Implementation Task Force. Last week, we marked a major milestone in our collective fight against COVID-19 in Manitoba. Together, we reached 1 million doses of vaccines administered. And today, 12 plus of Manitobans have, 70% of 12 plus Manitobans have at least one dose. These are huge accomplishments and a reason for all of us to celebrate. Vaccine numbers continue to rise, and that is something that I personally, and I know that everyone on our team is thrilled to see. But we haven't reached everyone, and there's a long way to go yet. This week, we'll give nearly 100,000 doses in supersites, pop-up clinics, urban indigenous clinics, and with our focused immunization teams. Next week, we expect to give about 175,000 doses through those same channels. And again, the number of doses we're providing every week does shift based on the number of doses that we receive from the federal government. As many people have heard, vaccine supply is definitely ramping up. We expect to receive around 300,000 doses of Moderna between this week, next week, and the end of the month. As Dr. Reimer noted, week by week, we continue to expand our outreach to make it possible for more and more Manitobans to have easy access to the vaccine. We do need to strike the right balance to get as many second doses to people who are eligible, while also supporting vaccine access and reducing barriers. So we'll be adding around 40,000 more Moderna appointments in Winnipeg starting next week. We're also increasing the number of doses available through our distributed channel model through medical clinics and pharmacies. So for comparison, we allocated 6,000 doses to these locations last week. With all the new supply coming in, we're increasing the next allocation 5 times to at least 30,000 a week. We know that medical clinics and pharmacies help reduce barriers for people who might not feel comfortable attending a supersite, and so this will help to improve access overall. We're also putting more doses into the community. We are allocating 180 doses per week to mobile clinics. These provide vaccine from a known and trusted source to some of the most vulnerable people in our province, including people who are unsheltered, who might otherwise be at risk. We have also allocated nearly 3,000 doses to 17 community-based clinics to support vaccine outreach starting next week. Working with community organizations allows us to leverage the trust and expertise they have with people living nearby in the communities where they are located. These clinics will be operated by businesses, nonprofits, and community organizations, and we're excited to see this work launch. We're also transitioning spaces where we'd have used focused immunization teams of our own so they can manage and deliver their own vaccine. These sites include hospitals, personal care homes, correctional facilities, occupational health and safety at healthcare facilities, and regional teams who can do home visits and provide vaccines to people who cannot leave their homes. We also know that walk-in appointments have been very successful in generating interest. This week's walk-in clinic at Lila has been a great example of that so far. We used all of yesterday's doses, and it opens again today at 1 p.m. We are also excited to partner with True North Sports and Entertainment to offer more walk-ins for first doses at select locations from June 17th to 19th, including our Gimli, Morden, Leela, Brandon, Thompson supersites, and the urban Indigenous clinics in Winnipeg. There is more information online about those dates, times, and locations, but thanks to them for their support and the first dose community vaccination tour by True North. Beginning next week, we will be pivoting to a broader approach to walk-ins more generally at all of our sites. We are going to be adding capacity to our super sites, with the exception of RBC, to allow for some walk-ins every day that a site is operating. These will be for people who still need to receive their first dose primarily, have not received their second dose, or who have an appointment in the future and do want to speed up the process for getting their second dose. We'll share more details about that in the days ahead on when sites are running and open and when this will all start. It'll begin no later than June 20th. These are incredible times, and the increase in vaccine deliveries means we can continue to get doses in arms quickly while improving access for as many people as we can. We deeply appreciate our partners who are helping to make this all possible, and especially our staff as we continue to celebrate Public Service Week. And with that, let's go over to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Danielle.
Hi, Dr. Reimer. With the way that the second dose rollout is going and the new Moderna supply, some people who are lower in the province's priority schedule are now getting their second dose ahead of those who are considered to be more at risk, some of whom are waiting up to 4 weeks for their second dose appointments. I was just wondering if this is a concern for you and the public health team, given the threat of variants, including the Delta variant.
I mean, we certainly want everyone who's eligible to be getting their second dose as soon as they can. Obviously, we used the date of first dose to mirror the prioritization that we did with first dose when it came to second dose. And so likewise, we do want people who are older, people who work in settings where they're going to be exposed to the virus to get their second dose as soon as they can. So even those people who have booked an appointment in July, they are welcome and encouraged to look to see if newer appointments are available. We know that with this new Moderna shipment, there will be new options for people to get the second dose. And so by no means are they required to stick with the appointment that they had previously booked. So, as a request to anyone, whether it's for you or for a loved one who may be at higher risk, either of severe outcomes or of infection overall, looking in the system and the ever-growing variety of options for you to receive your second dose is a great way to get it as soon as possible. And we're thankful for so many partners who are working with us to expand those options.
Okay, thanks. And at the tech briefing today, we heard about extending walk-ins, adding appointments, and getting more doses to doctors to use up this new Moderna supply. So I was just wondering if the vaccine task force maybe considered running clinics 24 hours a day or hosting pop-up clinics in parts of Winnipeg where there currently is no access to vaccination. Why aren't we taking that approach?
Yeah, no, thanks for that. And those are options that's part of our planning table and that we think about. The issue with running supersites 24 hours a day is that while this Moderna supply is robust and it's nice to see, this is supply that we can that still comes weekly, and we will be out of likely within 2 weeks or so. So if we wanted to run a clinic 24/7, we will likely still be in a scenario of having to then have a supersite sit idle for a day or two. And we're not just sending these Moderna to supersites, of course. We're taking a large amount of it, 30,000 in the case of pharmacists and docs per week, to send through other channels. And we do not dictate the hours that they run. So I think our focus is to get this out as accessibly and as fast as we can. The 24-hour model, given the amount that we're getting, doesn't quite make sense yet, but we can look at it.
From Global News, Anya.
Good afternoon. Dr. Reimer, this question is probably more for you. We know that people who get COVID build up some natural immunity, but I'm wondering how long it takes for that and what the differences or risks associated with natural immunity are, and sort of along the same line, if those people who have that natural immunity or have had COVID need to wait to get their vaccine for any specific amount of time.
So we do know that people who have had an infection with COVID will at least temporarily, most of them be immune to further infection. But we don't have large-scale studies the way we do for the vaccines to know exactly how long that immunity lasts, nor how well it protects against some of the newer variants. Whereas we do have studies that look at the immunity that develops after the vaccine and have seen that it is protective against the variants that we currently have circulating. So because of that uncertainty around how long and how extensive the protection from an infection is, we do still want people to get vaccinated to provide that full protection because we don't want anyone to experience another infection, regardless of whether or not they've already had one. So our approach in Manitoba right now is still to recommend 2 doses to people who have gotten, who have a history of infection. But we are looking at the data on an ongoing basis. There's some early studies showing that perhaps a first dose acts more like a booster or a second dose in people who have had an infection. But those are still small, and we'd rather err on the side of more protection than less, which is why we are recommending going ahead with vaccine for people who have had infection in the past. We also know from other vaccines that there are many circumstances where, because of the way the science has developed, we actually can create a stronger immune response with a vaccine than even the real virus or infection can do. And so it's not always true that the infection provides the best immunity after the infection is no longer there. In many cases, the vaccine actually is more protective for longer than the immunity your body developed after an infection. We don't know yet if that same situation will be true with COVID, but it's certainly possible that you could get better immunity after the vaccine. So as far as when to time things, we originally were recommending people wait 3 months after an infection before getting the vaccine. The main reason for that was just a supply issue. So if we knew that the vast majority of people with a history of infection were immune for at least a short period of time, it made sense to offer the limited number of doses that we had to people who had no immunity as opposed to those who had some. Now that we have so many more doses, that rationale becomes much less important. And so we are not putting any strict recommendations to anyone around the timing of the vaccine after their infection, so long as they've completed their isolation period. There may be some benefit to waiting a few weeks to give the immune system some time to fully respond to the infection before getting the vaccine. But it's more important for Manitobans to get vaccinated when it's convenient and available to them than it is to worry about the exact timing after an infection.
Thank you. And we know these walk-ups are going to be really popular. Even yesterday at Lila, the line was cut off at a certain point after 2 p.m. Can you give us more details on what these walk-up situations will look like in terms of how you'll ensure they're smooth and how you'll ensure people who have appointments aren't waiting longer than they need to?
Yeah, thank you so much for that. And we certainly hope that they are popular. That's part of the goal. So if what has happened at Lila yesterday, hopefully today and tomorrow, transpires at all the other supersites with the Walkin model, that's great news. In terms of how we'll operationalize it at the site, those with an appointment will still get their appointment at their appointment time. So they will have a separate line or a separate process, so they are not held up by the walk-in lines. Their appointment will be respected. And before implementing this walk-in process, we had all our usual lean management operation type analysis done so that we would not be impacting those who had an appointment already set. So they will get their appointment as per the usual time. In terms of those who arrive for a walk-in, there's going to be two groups. There are going to be those who are coming for their second dose, because it's earlier than their appointment or because it's more convenient. And then there are those, hopefully many, who haven't had a first dose yet. And we really want them to come to this convenient option. Both of them will have separate processes at the site as well, either through 2 lines or through regular intervals where the first dose folks are pulled from the line. Because the goal is, while we want second dose individuals to get their dose sooner if they would like it, we don't want to get in the way of someone who doesn't have any protection yet. That's been the direction from the clinical side, is we need to find a balance between dose 2 speed and dose 1 accessibility. So every single site will have a process like that in place, whereby first dose individuals, as much as possible, will get their dose, and second dose individuals, if they need to be bumped for someone who's a first dose, that will happen. Overall, the experience will be different. Manitobans are used to having a very regularized, planned way, appointment-based planned way, I should say, of getting vaccinations. We have not used the walk-in model at scale, partly because of the benefits that can come with an appointment process when supply is fairly scarce. As supply is looking to be more robust, and as we're looking to provide more convenient options, we're really moving to include this walk-in approach. But things are going to happen that Manitobans aren't used to, like arriving on site and being told they're all filled up for the day, there are no doses left. That will happen. That is now part of it. Or like waiting in line. Most Manitobans, their experience at even our largest sites are almost 0 waits or getting in early. That won't be the case in the walk-in model. It's different. So you may be turned away or you may be waiting for a bit. But the fun part about it is that you can show up on the day that works for you, and you might be able to get vaccinated way earlier than you thought.
From CJOB, Marnie.
Hello, good afternoon to you both. Dr. Reimer, you mentioned this in your opening remarks about people who can't get the vaccine for a certain medical reason. What other kind of conditions or allergies could prevent people from getting the vaccine, and will there be any accommodations made for them in terms of what they can and can't do, like the self-isolation rules and that kind of thing? How is the province going to address that?
Well, thankfully, there are very few medical reasons that would prevent someone from getting the vaccine. So being acutely ill, so if you're in the hospital with a severe illness, that would be one reason not to push your immune system at that time. That wouldn't necessarily apply to someone who's in the hospital for a long period of time for something like rehab. They would be able to receive the vaccine, but if you've just come in having a stroke, for example, giving a vaccine that next day is not going to be a good time for that individual. There are individuals who, because of their health conditions, may not be able to have a strong immune response to the vaccine. That doesn't mean they couldn't receive the vaccine, but it does mean that the vaccine is not going to be particularly beneficial to that person if we know that their health condition means that they can't create a strong immune response. So for some of those individuals, their healthcare provider might do an assessment and determine that the small potential benefit from the vaccine just isn't enough to make up for the very rare side effects that vaccine can have for the 1 in a million folks who receive it. But other than that, there really aren't any conditions, even within the immune compromise, that are an absolute contraindication or an absolute reason that you cannot get the vaccine. But there will be a few case-by-case assessments where people might have their healthcare provider determine that the risk and benefit ratio is just not in their favor enough. Finally, for allergies specifically, each of the 3 vaccine types that we have available in Manitoba have different ingredients. So it's extremely unlikely that someone would have severe allergy to all 3 products. And if they do have severe allergy to one of the products, they have the option of receiving a different product or seeing an allergist who can help them with that assessment and can decide whether or not it's safe for them to receive any given product and how they should receive it in the safest way possible. So even for those people with severe allergies, there will be very, very few who could not receive any of the vaccines that we have available in Manitoba. And then finally, there's people who, not because of their condition, but because of a treatment that they're receiving, can't receive the vaccine at any time. And instead, they'll have to time the vaccine specifically around their treatment cycles. So for example, some chemotherapy regimens that people take for different types of cancers might have a great enough impact on their immune system that the vaccine will only be effective at certain times in the treatment schedule. And we do have a process to be able to schedule people very specifically in alignment with their treatment process. So again, it's not that they can't receive the vaccine, it would be that they have to time it very carefully with their treatment to make sure that they're given the vaccine at a time when their immune system can respond.
Okay, thank you for that. And for that small population that might have these conditions, even if it is a very small group and can't get the vaccine, will the province make any accommodations for them in terms of what they're able to do that a vaccinated person would have access to? How is the province going to address that?
Yeah, so I know that the government is looking at that issue and having discussions around how best to accommodate a variety of different situations, and I'll have to let them give the update on how the rules might apply accordingly.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Reimer, what have you heard about Moderna hesitancy and the idea that mixing doses is going to affect, international travel and stuff like that? There seems to be people quite worried about dose mixing and how that will impact travel and that sort of thing.
Yeah, I mean, I absolutely can't speak on behalf of every country, but mixing mRNA vaccines is something that many countries are doing. So, Germany, Norway, Sweden, Finland, Denmark, France, Spain, all of them are using mixed schedules for some people. So again, I can't speak on behalf of what their border patrol plans are, but knowing that they are using mixed schedules certainly makes it probable that they'll accept mixed schedules as full vaccination as far as entry into their country. The National Advisory Committee on Immunization did indicate that all of the information they've received from other countries so far has been supportive of considering a mixed schedule to be a full vaccination. So the information that we've then received from them is reassuring that for most cases it looks like the mixed schedule will be accepted. But again, every country gets to make their own decisions. And so it is possible that some countries might have different approaches, but I have not yet heard of any country that would be refusing entry for somebody based on them receiving more than one type of vaccine as opposed to the exact same product. So I'm not aware of any circumstances where that's occurring at present.
Great, thanks for that. And for the second question, I wanted to go back to your comments about migrant workers. If businesses are deterring their employees from getting vaccinated, what is the province doing to kind of combat that, to ensure that these workers can get vaccinated if that's what they choose to do?
Well, I mean, to be clear, it's not. We're not hearing common reports of this occurring, but in the rare times that this might be occurring, we want to get the message to all workers, whether they're citizens of Canada or temporary foreign workers or any other immigration status. We want everyone to know that your employer does not have the right to deny you health care, including vaccination. And in this case, the vaccine also is provided free of charge regardless of health insurance. So we want to, through multiple mechanisms, get that information to everyone in Manitoba. So reaching out through the press conference and having all of the media outlets is one important way that we can get that message spread widely throughout the province. We also work with community organizations, and there's many of them that provide support to newcomers, including migrant workers. And so giving them that information as well can be really helpful. And then we're also connecting directly with employers. Each regional health authority has been identifying and connecting with employers of multiple different sectors, including manufacturing, including food production, farming with temporary foreign workers, to best reduce the barriers for their staff to be able to get vaccinated through a variety of different options. So we'll continue to reach out and facilitate the sharing of the information. And also we encourage community organizations to apply for the incentive grants because we know that in many of these cases, the community organizations will have the existing relationships and existing knowledge of their communities and of the needs of the people in their communities, and are better positioned than the provincial government to tailor interventions for their individual communities.
From CBC Radio Canada, Charles.
Hi. So this morning at a technical debrief, the journalists learned that you are projecting to make the second dose available to every Manitoban at the end of next week. Is that correct?
Thanks for that, Charles. So the way that our process works is we do monitor the available appointments. We look at our online booking system and the call center to see how well it's handling every time we allow a greater amount of second dose individuals to become eligible. We'll continue to do that. The difference is that we're able to do this now given the more Moderna that has come in. And the delivery models that we've put in place to ensure that a good amount of those doses are going to dose one individuals or to provide them with that option. We're comfortable dropping that eligibility likely every single day, weekdays, as opposed to that Monday, Wednesday, Friday schedule that we have been doing. That would put us approximately at targeting end of next week to have all Manitobans eligible to book for their second dose. But it's certainly not a hard confirmed line in the sand. Our approach has always been to monitor and do this sort of one step at a time. So we'll continue to do that. But yeah, we're targeting end of next week. That's what we're hoping for.
Thank you very much. And it seems like there will not be any increase in the amount of Pfizer vaccine that the province will receive. What do you think of that? The question is for the both of you.
So, of course, we'll take more vaccine if we can get it. We're not in a scenario of being completely awash in supply, despite the great news on Moderna. So, If a net new amount of Pfizer arrives between now and end of July, that's great. We will find a way to use it. But that said, the supply is robust and it is stable and it is steady, and we haven't had any shipment issues, for quite a while on Pfizer. So having 83,000 to 89,000 come in weekly and knowing that it's confirmed until the end of July is great. That's really good. We obviously are looking for what happens after July. Having an idea, a line of sight on what might be available at that time, as our targets want us to keep pushing beyond July to get a higher dose 1 coverage. So always waiting for more information from the federal government on that. But overall, the Pfizer supply is robust, and we're happy to see it continue to be that way.
From CBC Manitoba, Jill.
Good afternoon. I'm wondering if Pfizer and Moderna will both be available at supersite for walk-ups. And I'm wondering if people have to manually cancel their scheduled appointment if they find a walk-up opportunity sooner.
Yeah, no, thanks for that. Great question. The walk-in option at the moment will be for Moderna. So youth will not have, ages 12 to 17 will not have the opportunity of the walk-in sites at our super sites. The exception, of course, would be Indigenous youth who use the walk-in option at their urban Indigenous clinics. But the issue with Pfizer is that we've had confirmed shipment delivery schedules until the end of July for such a long while now that we've felt comfortable creating appointments and having individuals book. So the majority of Pfizer that we know is coming in has someone's name on it. All the way to mid-July, and as we keep opening up second dose eligibility, probably until the end of July. So we don't have as much Pfizer that we can just allocate out to make it a part of this walk-in process. The sudden announcement of a lot, 300,000 total Moderna, really allowed us to be flexible with Moderna in this regard. So not an option with Pfizer at the moment in terms of the walk-ins at the super sites. But if there's a net new amount of Pfizer coming in, that's something that we can certainly look at.
Thanks. And my follow-up is, how will the province facilitate transportation and access to vaccines for migrant workers whose, employer in the rare event, like you said, might be unsupportive, folks that may not have transportation?
Yeah, I think that's a great example of one of the things we would be interested to see community organizations use the incentive grant application for. The regional health authorities also have mechanisms to provide support to different groups, and so each regional health authority may have a different process for how they can assist people who need assistance with transportation. And I know that the United Way has also done some work on transportation as well. So there are a few different options for people, and we can certainly take that away to get a more fulsome list of the options for you.
From the Canadian Press, Steve.
Good afternoon. With more people looking at mixing and matching as we get these massive shipments of Moderna in and the steady stream of Pfizer, those who've received the first AstraZeneca dose, if they go to the government website, it says to wait at least 28 days prior to the second dose, but the recommendation is at least 8 weeks, and there have been studies that point to 12 weeks as much preferred. So what advice do you have to people who might be a bit confused by the different numbers?
Yeah, I think it's very fair to be confused because there are different numbers. So for all of the vaccines, regardless of what combination, the minimum interval between doses is 28 days. So we've made that consistent across all of them to ensure that there is enough time for the immune system to respond to dose 1 before that second dose triggers a boost to the immune response. For AstraZeneca specifically, in the original trials, there was a very large difference in efficacy between those people who received a dose at 28 days compared to those who received their dose after 12 weeks. So it was, 50-some% efficacy at the 4-week mark, but got above 80% efficacy if people delayed to 12 weeks. And so that is why with AstraZeneca, the advice is a little bit different than the mRNA vaccines. We saw that extended period of time really did allow the immune system to increase its response over time, and that boost was more effective when the immune system had more time to develop the immune response. So when it comes to offering mRNA after AstraZeneca, there are several trials that have showed us that this is effective, that you get a strong immune response. And the one trial that did a head-to-head comparison with 2 doses of AstraZeneca actually found that there was a higher immune response from the mixed schedule compared to 2 doses of AstraZeneca. But all of these trials used a minimum of 8 weeks for the interval between the first dose of AstraZeneca and the second dose mRNA. And so we can assume that probably before 8 weeks, you also get a very strong immune response, because what we've seen with 2 doses of mRNA is that you do get that high level of effectiveness even with a shorter interval. But that is a bit of an assumption. And so, to ensure that people have the best chance of being immune at the end of their 2 doses, we do recommend that people who received AstraZeneca for dose 1 wait the 8 weeks because that's when the trials showed us that there was a strong immune response. So it is very possible that that immune response would be equally strong at 4 weeks, at 6 weeks, but we've seen evidence that at 8 weeks it's there. So it is confusing. We're trying to decrease the number of different dates that we're sharing with Manitobans because we recognize that it's confusing, but at the same time, we also don't want to simplify it so much that we're actually reducing the potential effectiveness of the mixed schedule for people. So for the mRNAs, we recommend the minimum 28 days, and waiting longer is not detrimental in any way to how well the second dose works, even if you receive 2 doses of mRNA. The reason we tell you to get your second dose as soon as possible is because we want people to get that boost sooner. And with mRNA, the amount of additional benefit you get from waiting is quite small compared to the big benefit that we saw in the AstraZeneca trials when you wait. So for mRNA, minimum 28 days with no particular recommendation around waiting longer. For AstraZeneca, minimum 28 days before your second dose, but recommending that you wait at least 8 weeks just to give you the best chance possible of having that strong immune response.
Thank you. And Mr. Botha, in the technical briefing today, we were shown slides and one that included a projection far into the future, into the end of September, where the province is sort of aiming to have almost 90% of people having at least 1 dose. And I know it's hard to predict the future, but is that based on the uptake you've seen to date? And does that depend on wider uptakes? Because, we seem to be slowing down at about 70% right now.
Yeah, thank you so much for that, Steve. So the nature of any projection is that it gets less concrete the further you go into the future. And earlier, that sees us potentially getting past 80% of dose 1 coverage after Labor Day really relies on the booking behavior we're seeing of dose 1s at the moment, the available supply, and assuming that a lot of these accessibility models do work and do pay off. It doesn't accelerate nearly as fast as our dose 2s are moving, but everything we're seeing right now is that dose 1 booking and dose 1 in the arm is not stopping. It's not halting. It's leveled off. So that's the information that we have. And if we project that into the future, we do see us continuing to climb, but that will be a challenge. And the further that projection that goes out, the higher the probability that it may not, come to pass. What we are confident about, though, is our ability to hit the targets as per the reopening plan. So it's a little earlier than the 90% way down the line date, but our 70% of first doses by Canada Day, 70% of first doses by Terry Fox Day, and 80% of first by Labor Day. That last one will be that'll be challenging, but I think we're feeling confident we can hit those, and we certainly feel like we can hit our those two targets. I should add that overall, Canada's at 65% of first doses, which is leading the planet as far as I understand, or close to it. Manitoba is 5% above that. So along with our provincial counterparts, we're in terms of first dose coverage of a population, we are doing very well in the world, if not leading the world. So that shows that there is clearly a desire amongst the Canadians and Manitobans to have that first dose and hopefully the second dose, as long as we make it accessible for them to have it. So that is our goal going forward.
Our final reporter this afternoon from CTV Winnipeg, Michelle.
Hello, I just was wondering, we were using these dates like early June to hit 70% for first doses and the end of, I forget off the top of my head, but are we still using those same targets, or are you using the targets set out by the reopening plan now to meet?
We're absolutely aligning our work with the reopening plan. I think, as everyone knows, that the reopening plan is very, very tightly tied to vaccination rates. So the vaccine task force needs to be, keeping our eyes on the prize to meet all those targets because so much hinges on it. And so that'll be our targets. That's what we're aiming towards. Those dates and percentages as per the reopening plan. Of course, we aim to beat any target that we put out there, but we'll see how that goes, given supply, capacity is robust, but uptake on Manitobans is part of the factor. Right now, what we're confident in saying is that those dates in the reopening plan, everything is pointing to us to being able to meet those.
Okay, thank you. I have a question about providing Pfizer vaccines to First Nations or Indigenous communities for people who are 17 to 12, because mostly we've been giving Moderna to those remote communities. What are we doing to address that?
Yeah, so we have allocated Pfizer doses to our First Nation partners to be able to ensure that all youth who would like to be vaccinated on First Nation are able to. So in terms of they have that allocation, and we will continue to give them what they need at our joint planning table. In terms of the operations there and how that operation is going, by all accounts, it seems like it's going very well. But that's a good question for our First Nation partners in terms of Indigenous youth on First Nation.
Thanks, everyone. This concludes our media briefing.